Mental health concerns in World War II. Hello, I'm Penelope Gummelt, and I'm a sophomore majoring in nutrition with an emphasis in wellness. And also in this group we have Juan Martinez, Leila Amusin, and Daniela Garcia. So the period in health concern that we chose was World War II and mental health and PTSD. World War II marked a time of great political and social change and increasing awareness of mental health. Psychology today recalls that psychiatry was not a very established medical discipline, but this shifted following the end of the war and the National Institute of Mental Health was founded as a growing need for mental health care arose.
What's your name?
So what is PTSD? PTSD, as defined by the American Psychiatric Association, is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event. In Dunkirk, we see a prime example of this, with the rescued soldier who is silent for most of the movie until he gets upset when asked if he wanted to go below deck. This shows that this action causes a certain reaction, and this is the case for many individuals who come back from war, who have gone through experiences that no one else can really relate to. So how common is PTSD? It is important to note that anyone can experience the onset of post-traumatic stress disorder, but in a 2017 study involving nearly 6,000 United States veterans, 12.9% were diagnosed with PTSD, probably due to experiencing open combat, injury, witnessing death, or disaster, which is a striking high rate compared to incidence of post-traumatic stress disorder among the general population, which is 6.8%. Also, women are at higher risk of experiencing PTSD compared to men. So what causes this disease? The National Institute of Mental Health states that post-traumatic stress disorder can develop following the experience or witnessing of a shocking or disturbing event. Anyone can develop it at any age or point in life, and the disorder is not restricted to just veterans of combat. Some causes for the onset of PTSD include war and conflict, violence, physical and or sexual assault, abuse, torture, accidents, terrorism, and natural disasters, or hearing about someone close experiencing the above events. The National Health Service states that a previous history of mental health issues such as depression and anxiety may increase the likelihood that a person develops this condition. A lack of a strong support system such as friends and family may also contribute to developing PTSD following a traumatic experience. And the National Center for PTSD notes that with more prolonged exposure, the more likely it is that someone will develop PTSD. It is suggested that PTSD may be triggered after a traumatic event to prevent the person from re-experiencing it. Symptoms such as flashbacks and disturbing thoughts manifest with the intention of safety and personal well-being, but end up causing even more pain and suffering to the individual and their loved ones. The Anxiety and Depression Association of America warns of symptoms or personality changes like intrusive thoughts or recollections, recurring nightmares, emotional numbness, quickness to feel irritation or anger, and hypervigilance. So what can help treat this disorder? By seeking professional help, which would decrease the severity of the symptoms such as outbursts of anger, trouble sleeping, staying awake, hallucinations, or flashbacks. Instead of trying to treat a single symptom, it's best to treat the root of the disorder by speaking to a professional who is educated in this area, such as a psychiatrist who will assist and help a patient according to their needs, such as therapy and medication, or speaking to a psychologist who will guide the confronting past emotions and memories. So PTSD in conclusion, or just a general recap, it is not limited to veterans but can affect anyone that has undergone trauma. It causes symptoms such as flashbacks, emotional volatility, and nightmares, and it can be managed through various therapies, medications, and a strong support network such as friends, family, or a support group. As the National Center for PTSD notes, post-traumatic stress disorder is a natural reaction to trauma and is not indicative of mental or personal weakness. Intervention is possible and the disorder can be managed. One does not have to suffer through their trauma in silence. For more information, you can visit Anxiety and Depression Association of America or any of the resources linked in the references slide.